Good morning, everyone. It's September the 21st, 2023. Welcome to fall, everyone. It's the first day of fall. We're getting into the colder weather now, and that's changing everything, as I said, with the seasons with the homeless people. They're trying to head in more outdoors, so there's we're slowly seeing less activity on the streets at the moment, so it's coming down slowly again. But today I wanted to expand a little on that good feeling story that I gave you. I always advocate for the dogs, and I wanted to give you I turned around and I put up a little brief clip on Heidi with her brother Ace running. And I've talked before about Ace. He's doing much better now than he has been. But I've told you before how the homeless have come up. He's been threatened with a knife twice. They put a knife to his throat. He's had scissors at his throat too, from a man pulling scissors out of his dreads and trying to slash his throat too. And he's had withdrawals for 3 weeks after getting one of the street pills off the street and eating it. So he's been through a lot. His handler too, his owner, tried to train him as a service dog, just like Heidi, and that failed because he was nervous, anxious, and she had to go through a lot of behavior problems with him after that, and the various trainers. And finally, just like we use the Prozac to calm people down, that's what he's unfortunately had to go on, as Prozac, but he's doing so much better. He's not as jumpy now. He's easier to handle. He's now 4 years old, whereas Heidi is 3 years old now. So he's a year older than Heidi, his sister. But the two of them get along well. And doing the training with Heidi has helped as well, because it's made him at ease, because if we're on the sidewalk, I just take her first and he follows her and then watches what she does. So it's been a long road of recovery for him. But there's so much more that, as I was telling you in some of the more recent videos that I'm talking about, the therapy dogs that are necessary. The dogs are trained for so many wonderful things for people, and this is where I see the future going, is our best friends here, our animals, that are going to be able to help us into the future, because you talk about the pandemic, and the mental health has just got so terrible. And when I saw that woman, when I was sitting there in the EY Center in the show, and she just came up, ran up, and threw her arms around Heidi. Well, Heidi was just lying there quietly. Then she sat up and realized incoming, coming in, and she just sat there and then let the lady throw her arms around her, and she was just so thrilled. So I think it was a part of a mental health problem, which I'm seeing much more even in the seniors around me, and having been involved with Helped Age Canada and the a team that I worked with, which was called, we had an acting group at that time called Spectacular, and going into the seniors' homes and dealing with the ones with the dementia and the Alzheimer's, and seeing just what we could do with our playback theater, simply playing old tunes and singing old songs with them. I remember one lady, senior, 95 years old, and all of a sudden we started singing an old song, and she just kept staring at the wall constantly, and all of a sudden she just got up on her feet and started dancing, and then one of our male of the troupe got up with her and started to dance with her, and it was just a beautiful thing, because they remember so much in their past. And this is constantly what I think our seniors are needing, that they need this kind of comfort, because now they're put in old age homes. They're separated from their pets. I've seen people that are told, well, you've got to get rid of your 12-year-old dog, even though there's nothing wrong with the dog yet, but you've got to go into a home. So separating them is not good. And if that's not bad enough, we have the problem now of where you have the husband and wife, after, say, 50 years of marriage, they both have to go into a senior home of some sort, and they get separated. They can't even go in the same home. So I know there's been a lot of talk about this. So I also see where it's going to be down in the future, where I can see more. Like I said, the police departments are expanding them into the schools, into the community, where they're having the therapy dogs. The fire department's doing the same thing. Even the courts in the states are doing the same thing for witnesses and children who have to have witnessed horrible abuses and whatnot. The therapy dogs are helping them get on the stand and be able to actually testify. So I'm seeing a lot of good things coming in from the States, which they are doing right now, which I feel that we need to expand on up here. And this is part of the problem here is our seniors and the mental health. But even when I talk about the mental health with the drug dealers and the drug overdoses, those who are the addiction counselors and people that are trying to help them, it wouldn't hurt for them to have a therapy dog in with them during a session as well. Because I can see a lot of these people, when they see me, all they want to do is just pat the dog. And I have to be extremely careful when I let them pat the dog. So it's a big thing, a big serious thing that we have today. But I just wanted to brief people in on the way I'm feeling about what we need to be pushing our politicians to do. Much better for the seniors. The baby boom generation is a huge generation right now, and nobody seems to know what to do with this. Well, one of the things that can certainly help us is the therapy dogs. They're badly needed. Even in the old homes, we need more of them going in. But the problem is there's a shortage of trainers for therapy dogs, for service dogs, everything right across the board. Since the pandemic, we've had a shortage of people to put in jobs. So this is one big area I try to encourage the young people to get into, is helping us with training the dogs as well to help us. And they'd be helping our society at the same time. So there's a big opening right there to be able to help us to get definitely service dog trainers and that. Because what I'm seeing happening now is with everybody demanding them, they're so in such high demand, we don't have enough trainers. And the few trainers that we do have, I've been told, well, they're not in the Ottawa area for the simple reason they've all gone down to Petawawa to be trained for service dogs for our Army, our service personnel. So that's where they are. And it's been very difficult even to get a trainer for Heidi. But I've been doing the training myself. And it's amazing because I've been trying to do the best I can. I have the service dog books. I've been trying to follow the service dog books, although I do it a little differently because I'm in the community. I love being with the community. She's got to be overall totally different from the normal service dog, and that's what I've been training her to do. And I think the nicest thing I got was when I went to the EY Center there for the senior show, and I was sitting there eating, was this woman came up to me, and ironically she was apparently one of the trainers for the blind dogs, and I got the most beautiful compliment that she said I was doing such a good job on training her. And I was kind of surprised to have someone to come up and compliment me like that, because a lot of the problems with the service dogs are that you can train your own service dog, which I've been doing. I've got her beginner's certificate now, but it's taken me 7 months from the time that I was in the hospital to get my knee and my leg back in shape to go into further training with her. So I'm hoping soon to hook up with the more advanced obedience training with her that she needs as well. But she's been quite well obedience trained, and she knows my signals, so we're getting across. And she's also 3 years old now, so she's getting much more mature. So I'm trying to call around to see if I can get a service dog trainer for a little bit more in-depth trainer. So she may be a little bit behind schedule, but she's doing great, and that's one thing. She's a very, very smart dog and doing very well for me. So I'm very pleased with that. But I just wanted to give you a little bit of an idea of where we are possibly going for the future. And because with the addictions and the drugs and the mental health that we have down here, this is one of the things that could be in our arsenal, is the dogs to help with mental health along the way. And this is something that we really need to work on. And this is where I am today, and I just want to thank everyone for listening to me. And I always love your comments. But I just wanted to tell you today, this is where I think one of the things that we should be headed for in our future to get out of this pandemic, because 2 years put us into it, and I think it's going to take several years to get us out of this pandemic. And everybody is playing the blame game on who to blame, who not to blame. Oh, it's Trudeau's fault. Oh, it's the government's fault. Oh, it's Ford's fault. Well, it's everybody's fault. We're all in the same boat here, and we all have to come out of it together. So we really need to work together. So that's what I have to say today, guys, and everyone take care, and we shall talk to you again soon, and bye-bye.